Hi, I'm Dr. Chris Tolcher with Parkway Pediatrics. I'm here with Dr. Chris Fulton of Fulton Psychological. And we're here because it's May, and May is Mental Health Awareness Month. And we decided that we would sit down and talk with you and give you some quick pointers for parents about dealing with the two most common mental health things that we see in our practices, anxiety and depression. So Chris, welcome. Thanks so much for being here.
It's great to
really
be here.
appreciate It's great to collaborate with you.
Mm-hmm.
We've known each other over 20 years.
Yeah.
I won't say how long, but we're in practice. We're in our third decade practicing about the same length of time.
Yeah.
And so you work here in Calabasas with Fulton Psychological, and you're the founder and owner
Yep.
of the group, right? And you have a
Yep.
team of psychologists, and you cover everything from testing to treatment and therapy to also even psychopharmacology. You have a psychiatrist on site too, right?
Yeah, we cover a lot of things, try to make
Okay.
it a one-stop shop for people.
Good,
Mhm.
love that. So thanks again for being here. And so
Um,
let's dive in. So anxiety and depression are two really common things we see. I know I see a lot of it. You also do as well. So I thought we would start by talking about, we already know they're common. We know that it's on the rise. We don't really need to get into that. I think it's also very good for parents to know that sometimes the signs are easy to see.
Mhm.
Sometimes they're a little more subtle or hidden.
Mhm.
But I think the most important thing is we want to answer two questions that parents may have. One is, when should I be concerned, or what are the warning signs that I should be looking for when it's more than your normal amount of anxiety or depression? That's number one.
Mhm.
Number two would be, how do I help my child?
Mhm.
What can I do?
Mhm.
So we'll start with anxiety.
Yeah.
We all have worries.
Mhm.
I do, I know you do. Life can
Mhm.
get stressful,
For sure.
right? And we can have our fears and worries. But when does it cross the line from a little bit of normal worrying into a problem, or what we would call a disorder?
Mhm. Well, it's interesting. I think anxiety in some ways has gotten a bad rap because I think people don't realize that it's really something you need to be at your peak performance. We work with a lot of even kid athletes and performers, and you need a certain amount of intensity. We call it kind of this intensity bell curve, where if you don't have enough, you just get kind of lazy and withdrawn. If you have too much, you get disorganized and out of control. So there's an optimal level. So when it goes from an optimal level where it's it helps you, study for a test, it gets you motivated to study for a test, or it helps you be able to, go play a sport and be at your best, is when it becomes debilitating. You can't play that sport, or you can't focus on the test. You can't perform because you're so anxious that you're forgetting all your lines. And so really when it interferes with a lot of the performance is when we're gonna say, you know what, we need to probably dial down some of that intensity.
So a little bit of it is normal and healthy and just how we're hardwired,
Mhm.
and it can be helpful.
Mhm.
But when it's excessive or persistent, or really to the point of affecting your performance in a negative way,
Mhm.
and I would say in my world, when kids just don't function very well in their day, right? In your world too, right? From
Mhm.
anything from school to sleep or whatever, that's when it kind of crosses the line from normal into a problem.
Exactly.
Is that a fair way to put it?
Absolutely, and especially when it creates avoidance behaviors. After COVID, we saw a lot of school avoidance. Kids that just were hey, I'm not going to go there anymore. I really like the comfort of being at home. And what happens is it starts manifesting. You see this because you make the referrals to me, because they start getting stomach aches and they get headaches. And the parents are I don't know what's going on. And you figure out that there's nothing physical going on, and that it's really anxiety that's keeping them from being able to function.
That's a perfect example of what I said a moment ago, that sometimes it's obvious,
Mhm.
I'm really worried, I'm scared, and I'm stressed out. And in my world, in kids and teens, it often shows up in my office as, my head hurts, my stomach hurts, I don't feel well, I'm too tired,
Mhm.
I can't sleep. Sleep is a big one, right? So if I'm a parent and I'm concerned that my child may have more than a normal amount of anxiety, what are some other warning signs I should look for? We mentioned a couple right now, but are there any other examples, things they should be looking for, when to be concerned?
A couple other things, the avoidance is a big one, physical symptoms, and I would say when they start getting a lot of intrusive thoughts. I get more and more kids who have some form of OCD. One right now, this kid is not wanting to eat anything around their backpack because they think the backpack has some contagions or, something really bad on it that's going to get them really sick. Maybe left over from COVID, we're not sure. But anytime that they have a lot of intrusive thoughts, things that they're just persistently ruminating on.
Gotcha.
Definitely.
So the take-home message for parents on this is, when it's to a point when it seems excessive or persistent or really troublesome, holding them back in some way, causing them problems, that's when it should be a flag that, gee, maybe I need to get some help or help my child in some way.
One of the kind of stealth ways that anxiety shows up too is when they get sometimes irritable. I see this pretty often where like kids just start getting really kind of agitated or easily upset, and the parents are like, what is the deal? Like my kid keeps making a mountain out of a molehill. Some of that is anxiety, and so you have to make sure, I always work with parents on making sure that you don't respond to the anger part of it, that you kind of find out like there's some anxiety behind it.
Another great point. I see that too. And I think of a couple other things where sometimes kids will get random racing of the heart, or a lump in the chest, or a tightness in the chest, lump in the throat, sweating. Some kids feel hot or cold when others don't feel that way, as a physical manifestation of anxiety. And of course, sleep is a big one. I mean, and the number one cause of insomnia in school-age kids, from what I see, is anxiety, or the brain won't shut off.
Yeah, sleep can get interfered with anxiety. And it's hard to fall asleep, and you know there's certain methods to be able to help them with that. And if it's hard to stay asleep, sometimes that could be depression. So it's kind of a differentiation between the two.
And sometimes there's a big overlap between anxiety and depression. One they commonly coexist, or excessive anxiety can lead to depression, right? So there's an overlap there, isn't there?
For sure, chronic anxiety is often a precursor to depression. So that is something that we take a look at. If we don't treat the anxiety early enough, it can often turn into depression because it creates that hopelessness. Like, I'm stuck in this bad state.
Perfect segue into
the
next subject.
Depression.
So now, let's chat about depression. We've touched on it a little bit because there is an overlap here. So kind of like I said with anxiety, a lot of us, we have our moods up and downs. I know I have sometimes I have a down day or a sad day, or I might experience grief over something in my life, like a loss of some kind. Or when does it cross that line between you're just having a rough time, normal amount of mood fluctuation, or it's bad enough that you should get some help?
I always look at two big factors: severity and duration. You know, if it's so severe that, you know, someone's suicidal, or they're saying there's no point of life, you know, that is definitely has crossed the threshold. You need to get some help. Same thing with like a low-grade depression. You know, we call it dysthymia, where it's just super persistent. You know, it's just really nagging at the person. They have a lot of negativity, kind of some hopelessness. Again, you know, they can be angry and, you know, kind of irritable. So anxiety and depression can both kind of funnel that energy into that kind of angry monster, as we call it.
I see that a lot too, and I see that a lot of times we tend to think of depression as crying a lot, sad, down, which it can be for a lot of people, but anger and irritability, especially in young men, I feel that's a much more reliable sign of excessive, you know, like a raw nerve.
Exactly.
Excessive agitation, irritability, or really agitation, not the right word, but just anger. And that often is a manifestation of depression. And you know, what I often see in kids is that it really is, you hit the nail on the head. It's the persistence and the severity. It's beyond the norm. Anytime it's lasting, our questionnaires often ask for how do you feel in the last 2 weeks? Because when it's going on more than 2 weeks, that might indicate a kind of a persisting situation.
Well, you bring up an interesting point too, a differentiation between girls and boys, because you're right, boys will be a little more agitated, and they'll be a little more in your face. Girls will be a little more withdrawn and morose and sullen. So that's the other thing, you know, if your kid is really not wanting to participate in their typical fun activities, like they don't want to do sports anymore, they don't want to see their friends, you have to kind of check in and say, hey, you know, what's going on? You know, again, if they're angry, if they don't want to do their schoolwork, even that could be a sign. I was talking to a parent today, and they're like, well, you know, sometimes my kid seems fine, so there's no way that they're depressed. And they go, depression shows up different in kids. You know, parents, adults could be like down all day long, you know, for weeks. But kids, it's a very unusual thing, even in grief and loss. Like, I've had kids who literally lost their parents days before, but they can have like moments where they're playing it. It seems like they're fine. So kids can look fine for, you know, periods of the day, but they're gonna still kind of go back to that kind of like low point, that low mood, and, you know, ruminating on things and just really kind of sad.
You said one thing also that reminded me to say, I want to be clear that with folks that are listening, that these problems can start at young ages.
Oh yeah.
I mean, we tend to think of teenagers and young adults, you know, up to older adults like us struggling more, but we see kids down as early as 3, 4, 5, 6 years old struggling, especially anxiety tends to manifest it much earlier. And it can start with just significant separation anxiety, school anxiety, specific phobias, specific fears, and then it can generalize as they get older, as one example. And even depression, I recently saw just a situation of a child that was about 7 or 8 years old with a significantly low mood and talking about, obsessing about, like, you know, dark themes.
Yeah, especially about themselves. They'll start having dark themes about, like, you know, typical things that might be frustrating, like school. They're like, oh, I hate school. But when it starts to go inward, when they start really talking about like, well, I suck, or I can't do anything right, I can't, play any sports, and they want to quit all their sports, again, that's when it becomes a problem.
Good point. I think I would maybe summarize this part of it for parents by saying that, and tell me, of course, add whatever you want to this, Chris, but it seems to me that there's a lot of symptoms of depression. When you look up a list, there's like about 10 or 15 of them. But I think the three most reliable ones are a persistent, significant depressed mood, might be sadness, hopelessness, feeling down. Number two would be excessive moodiness, irritability, anger. And number three would be they just, the blah feeling.
Yeah.
They lose an interest in things they usually like to do. That's a flag for me when they start now not wanting to play their favorite sport or not wanting to hang out with their friends. That can be a real flag.
Definitely. And, to actually go into your domain, the physical signs, again, like anxiety, could be a problem with sleep, could be an appetite, issue. They could be overeating or undereating, lethargic and not energetic. So there are also a lot of physical symptoms as well.
Thanks for bringing that up. I see a lot of chronic headaches in depressed kids, especially is a big one.
Definitely.
The chronic daily headache that doesn't respond to medications, and a lot of sleep problems, either too much sleep, not getting enough sleep, like you touched on, the insomnia in the middle of the night is often a sign of mood issues. So excellent. And then I also want to finish this segment on one point, which is, and you touched on it earlier, but I want to highlight it. There's normal moods, there's significant depression, which we might call maybe major depression in our fancy language. And then there's depression that becomes really an emergency. What are the warning signs that a parent should look for and when to be concerned that this can't wait? My child's life may be in danger.
The first signs are usually they start withdrawing from, let's say, friends, and we'll talk about this in a minute because that's the number one thing that we need to do to kind of protect them from it. But if they withdraw from friends and they don't want to be with friends, they don't want to do any of their fun activities, they've given up in school and they're not doing their assignments, that's one of the first kind of signs. The next level is when they start really making that self-deprecating comment or they're really negative about themselves, and they'll start making comments like, what's the point of life? I tell parents, I go, listen, you got to be able to ask a kid, it's usually teenagers, not a lot of young kids in this stage, where if they're saying like, hey, what's the point of life? You need to ask them, like, are you thinking about ending your life? Sometimes parents will think, oh, if I bring this up, then it's going to make them think about it, and they didn't before. You're not going to make a kid suicidal who wasn't before. Okay, this is not going to happen. But you have to make it a safe place for a kid to talk to their parents about it.
I love that point. Don't be afraid. It's a fearful thing to even bring up. We're both parents. I mean, and anybody that's listening, this is a heavy subject. But we can't not talk about it because it happens sometimes, and it's one of our darkest fears as parents, our worst fears. So we need to know, when should I be ready to, call my doctor, seek urgent attention. Or I tell parents a simple way to think about it: when your child is saying things that makes the hairs on your neck stand up, I call it the Spidey sense, because I was a Spider-Man fan growing up. But that sense that, okay, I'm scared, that follow that, right? Reach out for help. We'll talk at the end about resources people can use for that. So I think that's helpful. Anytime a child is really saying things that scare you, you should delve into it. Let's launch into so we've kind of answered the question. Number one is, when should parents be concerned? When does it cross the line? Let's now go into what can they do to help.
Sure.
What are the best ways parents can help? So we're parents, or let's say you're talking to a parent now. We might go back and forth between anxiety and depression because there's a lot of overlap.
Yeah,
so
definitely.
Tell me, what do you think? How do we start talking to parents about how to help their child?
One of the first things that I tell parents is that you need to stay calm. Because a lot of times, like, can you imagine if your 14-year-old started talking to you about like suicidal thoughts? You just want to unravel. But I tell parents, for multiple reasons. For anxiety, if you don't stay calm, you're actually going to make them more anxious. You're going to make them, because it's called social referencing. When they're kind of confused and they're not sure how to respond, they kind of look to a parent of like, how do I respond? And if you're losing your mind, guess what? They're going to lose their mind. So staying calm is huge. For depression,
Even if you're not.
Even if
inside you're a wreck, right?
I call it game face.
There it is.
You gotta have to have your game face,
because
a lot of times, I was just talking to a parent about all sorts of really upsetting things, and she kept her game face. I'm like, way to go, because now your child feels safe to talk to you. So it reduces your child's anxiety, but also for depression, it'll make it a safe place for a child to talk to the parent. Because I've had kids literally say, oh, I don't want to tell my parents that I'm suicidal, they'll just overreact and get really upset and, Dad will kill me. And I'm like, no, they'll be really upset, but they'll be worried and they want you to talk to them. And so I always tell parents, game face, super important. That's the first step in it all.
Yeah, and I'll piggyback on that. Also, don't blame yourself.
Yeah.
Right? There's a lot of shame and blame that we feel. We might even project that on. We might blame our, well, if only you would have done this. You know, we like to try to fix things for them. So the best thing they can do is really connect and listen much more than you talk. Right? I mean, listen, hear them out. And I would even suggest starting the conversation with, well, how do I start the conversation? Say, you know, often you ask, are you doing okay? And the classic teenagers, I'm fine.
Yeah.
Everything go okay at school today? Yeah. You know, you get those quick one answers. But maybe delve a little bit. If you don't get that, when you start with it, say, you know what, can I be honest with you? I'm a little concerned about you, and I love you, and is everything okay? I mean, and if they need more, here's what I'm concerned about, and then just listen. Don't try to fix it for them right away. Listen. They need to know that you care and know that you love them.
You bring up an excellent point. One of my top 3 parenting tips is don't tell, ask. So you were saying, like, make sure you do some listening. I say the same thing. I go, you could get some really good intel. If a kid says, hey, I'm really anxious about going to bed, you know, alone or something like that. And if you quickly go in to fix the issue and start saying, oh, you don't need to be scared, and this is all the reasons why. I don't know, you might not know all the reasons why they're scared, because maybe, you know, one of their friends' parents got sick and has cancer or something like that. And so now they're experiencing like a separation anxiety. And so you always got to start getting a little bit more information and say, all right, so what do we do about this? Or what's causing it? And get them to problem solve, because that's another coping mechanism. You have to teach your child how to problem solve. But if you go in there and solve all the problems, they're not going to, you know, it just doesn't sink in for them. So I always tell parents, make sure to ask more questions. Like, how would you handle the situations? Like, you know, if they're scared because they're going to strike out. It could be that simple. Yeah. Okay, so what if it does? You know, what happens? Because a parent often will go, oh, don't worry, you know, Johnny just struck out, you know, every time, or, you know, the time before, don't worry about it. But, you know, your child is just going to be like, that doesn't compute, it doesn't sink in. So to get coping mechanisms to sink in, you have to actually have your child process the information and think about it. And think about alternatives. And even throw out a couple, you know, crazy alternatives. And I always say, oh, you're going to get kicked off the team if you strike out, right? And they look at you, no, I'm not going to get kicked off the team. So you want to offer a couple of suggestions too.
And that opens up a good window into one of the things that we help teach kids, is that it's that negative, exaggerated thinking, catastrophic thinking, like Absolutely. The worst thing's going to happen. That's what anxiety does, right? It's like, my dad's going to kill me, right? Or I'm going to get kicked out of the house, or something dreadful like that. It's usually not the reality. That's what anxiety does. But I think one of the things I'm sure you do this a lot in your therapy sessions, is teaching kids to practice changing negative thinking into positive thinking. Absolutely. I know what you are. You're a worry thought. You're exaggerating, and then think of something positive to talk it away. That's an important skill for kids to learn.
It's so funny, because I was talking to someone. I go, gosh, you know, I remember going through, you know, some kind of philosophical studies when I was in high school and college and learning about Buddhism. And I'm like, I learned later. I go, that was the first cognitive behavioral psychologist, was Buddhism, you know. And then my son goes, hey, have you heard of this guy, Marcus Aurelius? And he taught me about Stoicism. And I was looking at that, I'm like, wow, this is like a long time ago, but it was the same rationalism. And it's the same thing. It's all about mindset. And I learned it because I'm a cognitive behavioral therapist. And so we go and say, hey, you know, how can we change your thinking? Because thinking leads to how, you know, you react to it, and then it leads to an outcome. So you look at a situation, and what happens is it runs through a filter. And to your point, what happens with anxious people is they always increase the probability of it happening, and they increase the severity of the situation, catastrophic thinking. So those two variables. In that mindset, then that filter will create this interpretation like, oh, I'm doomed, you know, this is gonna be an awful situation. So then they feel panic, and then they avoid the situation, and then the outcome is what we would consider a phobia, because it's like, hey, you know what? I'm afraid of going to school because all these terrible things are gonna happen. It could be as simple as, I'm afraid of throwing up. Emetophobia is a really big thing now.
So is.
I get so many kids
who are kids all the time.
Yeah, they're just afraid of throwing up. Yep. And you know what our treatment is of it? We actually have them start talking about it.
Don't tell me you make them throw up. Okay.
Close. Close. I actually told a few kids, I go,
we might part ways.
Yeah, I know. I actually told a few kids, I go, I hope you throw up. They're like, you're such a mean doctor. And I go, well, it's actually worse having this fear day in and day out than the, you know, few minutes of discomfort of the vomiting. But essentially, it's exposure with response prevention. We sit there and go, hey, guess what? You know, we're going to get you to read about it, think about it, talk about it, watch a video. We even have like a whole protocol of videos and things like that. No, I'm not going to give them Epicat and make them throw up, but at some point they'll get nauseous at least, and so that'll be kind of exposure.
In some ways, it's part of learning that it wasn't as bad as I thought it was.
It's so true.
And so I also tell kids that when you practice this talking away negative thoughts with positive thoughts, is that, oh, I do that, it doesn't work. And then it's true, it doesn't work right away, and it's hard. Anxiety thoughts and worry thoughts and negative thoughts keep coming. They have to keep practicing. Like you want to be good at dance or baseball or your favorite video game. What do? You do it over and over again. You practice. You got to do the same thing with these techniques to talk away the negativity.
Absolutely. One of the first treatments that we also do with anxiety is the teach toleration, because what happens is people become afraid of being afraid. And that's what becomes debilitating, because being afraid isn't bad. There's certain things like, okay, I'm afraid of speaking. That's the number one phobia, is speaking. It's more than death.
Wow.
Is actually speaking in front of other people. And so it's kind of funny, because I'll say, hey, listen, we're going to bring anxiety with you. In fact, I was treating someone earlier about fear of being on a plane. And I was teasing them. I'm like, hey, listen, you don't have to pay extra for the ticket for anxiety, but it's going to be there with you. We just have to learn how to actually exist with it and not let it be so debilitating that it keeps you from doing the things that you want to do.
Excellent.
Yeah.
So we talked about some examples of how we would teach kids to teach our patients to deal with anxieties and depressive thoughts in the moment. There are a lot of other techniques that we don't have time to get into. Like relaxing, meditations, the physical things like that. I also have kids focus on just get back to basics, healthy life habits. Practice a healthy lifestyle. Sleep, so important. Exercise, so important. Healthy eating, right? Sometimes you got to also get that foundation for anything to work.
Oh, it's so funny. I was talking to someone earlier today, a kid that had both anxiety and depression, and I told the parents, I go, by the way, the first fundamental things is how's he sleeping, how's his eating, and, is he getting exercise? And I'll tell parents, I go, that's more important than therapy. If you're not doing a healthy lifestyle, the session isn't going to make any difference. And so you really have to have the healthy lifestyle. And that includes, a social support system. It's actually the number one correlate with mental health is a perceived social support system. So you got to have some peeps to go to. You got to have some friends. So I always tell parents, whether it be anxiety or depression, a good kind of protective coating in our, emotional armor is having a good group of friends.
And I'll even lump in their family too. Now, granted, some of us have maybe easier or not so easy relations as we get into the teen years. They tend to be years of conflict and battle, but a lot of studies still show that even more than their friends, kids care very much what their parents think about them.
For sure.
And that's why listening and being there and just connecting, even if it's only 10 minutes a day, can make a huge difference.
It's in the top 3 reasons for anxiety is if there's parental and just family conflict. If there's a lot of discord, that's their support system. And if there is problems and discord in the family, you're right, it's going to lead to anxiety. The other one is schoolwork. But to go back to the mindset, I'm always telling parents on how to make sure to not have catastrophic thinking for the schoolwork. If I get a B on this test, my whole academic career is gone. So it's just trying to change that mindset.
So that brings up one of my final questions, which is, when do they need us? And I think we kind of hinted at it a little bit, but we're trying to give tips to parents for how to monitor and manage things at home. There's a lot more that could be said and done. So like in my world, they might come to me because of sleep issues or headaches or tummy aches, or maybe it is just they're down and depressed and parents are worried about them. But tell us more about what's your role as a mental health provider, and when should they see you?
Again, it kind of goes back to that duration and severity. So if the anxiety is they're nervous about going to, their baseball games, but they seem to still, manage to get through the game and they're okay, that doesn't need a shrink. If they're a little bit, stressed about, a test or going to school, but they manage to go to school and they're able to function, again, don't need me. It's when they're not going to school, or you could see their heart just racing before a game or something like that. Then I would say okay, we need to make sure it's medically there's nothing going on, and then to go into the emotional doc. And
that was a perfect segue to me, because my job as the general pediatrician is to make sure I'm looking at all the possible causes, that not just attributing everything to anxiety or depression. I have to think of it. I have to make sure that there's not a physical problem going on, because there are a lot of physical symptoms that go along with these conditions, as we talked about. So it kind of, in some ways, it kind of starts with me if they don't already have a mental health provider. I tell parents, when you feel like you're worried or you're upset or scared and you don't know what else to do, you feel like you've done everything you can, it's time to reach out for help.
Yeah.
And start with your primary care provider, and we can kind of be the triage person, or even I'll call the
You're
gatekeeper.
the quarterback and the gatekeeper.
The
You're
quarterback
the person.
of the team. I like to refer to myself as that. Thank you. So yeah, and my job is to triage it. Some are mild, and maybe they just need some tips with me, and hey, let's talk again in a month or two.
Exactly.
The more medium ones usually need a little more. They need therapy, a referral to someone like yourself, maybe even a possible medication. I don't want to focus on that now, but everybody knows there are medications out there for the more medium to severe cases, especially those that really need it, where they're really, things are just really bad, not going well, or they've tried other things and now, that's where it kind of comes to, right, when they need medication.
Yeah, and we do the individual work with the kids, give them all the tools, change the mindset, give them some relaxation tips, for anxiety. For depression, again, it's changing mindset about how they see themselves or their lives. And then we like to work with parents, because parents can make or break. They're either going to create work for me, or they're going to put me out of business, as I call it. And I always tell parents, I go, hey, listen, I'm going to give you some tips on that, they'll put me out of business quicker. And it's that listening, it's the empathy, it's the staying calm. Literally, I had a kid one time who was having a panic attack at a school, and I said, just look at me. And they go, we're going to breathe together. And I've done this with kids who've had panic attacks in my office, and I teach parents, I go, guess what? If you just sit there and breathe with them, you're going to actually slow down the sympathetic nervous system. But I'm going to give them tips on how to, teach a kid not to be so self-deprecating or hard on themselves.
Excellent.
Absolutely.
And then my final question for you before we wrap up is, where can parents go for more? What is a few little suggested resources of things to either read or watch? I mean, obviously, aside from reaching out to us, who can help them also with resources, but.
Yeah, sometimes the counselors at school are a good resource, by the way, another, person. American Psychological Association, is usually one of my go-tos. I would say that
they have a website with some good patient and parent-friendly handouts.
Exactly.
Yeah.
Absolutely.
Good.
So that'd be good ones.
And I'll add to that, and as a pediatrician, the healthychildren.org is the official website of the American Academy of Pediatrics, which has a lot of quick when to be concerned, more detail about this. For example, we didn't even touch on the effects on electronics and media and all of this, which is the subject for another one of these talks, which is just another huge and important subject. But and the last thing I'll say is that if you feel that your child may have a really serious, potentially life-threatening condition, know about the local crisis hotline. There are crisis and suicide prevention hotlines.
Yeah, and it's funny because parents, even of my patients, will be like, hey, what do we do in that crisis? Two things. One is you take them to the emergency room, and because there are psychiatrists at the emergency room, and they will do an evaluation. And under really extreme situations, you can call the police, and they have a psychiatric team that's associated with the police. It's not like they're going to show up and arrest your child. If you have a 14-year-old who's has a knife or something and said, hey, I'm going to cut myself, and you can't disarm your teenager, you let the police know, hey, listen, we have a person in distress, we need to have them come, and they know how to de-escalate, and then they have a pet team that comes in and helps out.
Great. Any final comments for our listeners? Anything you think that we missed that we should? It's a brief overview, granted.
No. Make sure that you hit your kids with lots of love, lots of empathy. You don't have to be effusive with all the compliments and things like that, but definitely give encouragement. Be fair with your criticism and things like that. But emotional support really starts with parents. So good luck with it all.
Don't underestimate how much they care about you and love you.
What you say.
Especially during the teen years when they just want to hide in their room and be away from you. They really do care. And remember to listen much more than you talk. Don't try to fix everything for them. And if you are worried, reach out for help. There are people like us that are here to help you. I'm Dr. Chris Tolcher from Parkway Pediatrics, Dr. Christopher Fulton from Fulton Psychological.
Fulton Psychological.
And thanks for listening. Have a great day.
Thank you very much.